Hi, my name is Alyssa Cook, and today I will be talking to you guys about my speech. My dream job is to become a radiographer. As William Cecil Dampier once said, author of A Shorter History of Science, published in 1944, great discoveries are made accidentally less often than the populace likes to think. Have you or someone you have ever known broken a bone? If so, they might have needed an x-ray to get this image. Radiographers also do scans like MRIs or CT scans. A radiographer's job is to take these certain scans of patients, which is very important into getting a patient the correct treatment. Why do I want to become a radiographer? Yes, it's more than just the money. Or is it? No, I'm just kidding. I've always been interested in the makeup of the human body. And what better way to learn than to literally take a look inside? My dream job is to become a radiographer, either working in a doctor's office or hospital setting. In this speech, I will be explaining what a radiographer's job entails, some new things that I have learned, and why this is my dream job. Where do radiographers work? For starters, radiographers work in the medical field. They deal with patients in a few different settings. They mostly work in hospital settings, but can also be found in doctors' offices, diagnostic laboratories, and diagnostic imaging centers. According to Radiology School 411 on how to become a radiology technician, they use medical imaging to produce images consisting of bones, tissues, organs, and vessels. It's not all consistent of working with images. You do need to have bedside manner as well, as you might have to have contact with someone who's just been through a traumatic experience. You need to work well under pressure because you never know how life-threatening a situation could be. These are some images of a CT scan. You can see the CT of a brain right there, as well as X-ray images. Like I said, bones, vessels, that types of things they would be looking for. This is an image of a mammography, so they would be looking at the tissues of the breast in that specific scan. Some interesting points that I learned while doing research on radiography is that according to weirdfacts.com on 9 interesting x-ray facts, the discovery of x-rays was discovered by William Röntgen on cathode rays. He was actually doing some research on cathode rays when he came across x-rays. So this is what the first x-ray machine would have looked like. As you can tell, we have came a very long way since then. I first became interested in this job when I was pregnant with my son. As you can see here, this is an ultrasound of my son. I thought it was very interesting how I could literally see him before I even had him. I really did fall in love with that type of imaging then. It was really cool that I could hear his heartbeat and find out the gender and everything like that. So without that technology, I don't know my experience with that would have been the same. It led me to do some research on the different types of medical imaging that there are. So right here you can see this is an x-ray machine. Right there, that would be a CT scan, and this would be a mammography machine. So ultrasound is a different field than radiography. It is sonography. So they are very similar in the fact that they do both use medical imaging to diagnose different types of things, whether it could be cancer or looking for masses. You know, they're different, but it led me to find radiography. And I was more interested in radiography because there are more advances in the field. There's more, to it. You can go into CT scan, you can go into mammography, or you can just stick to x-rays, either one. There's more to the field. When I think of myself working in this field, I can already smell the sterile aroma of a doctor's office, listening to the small talk of my patient as they are preparing for their scan, the touch of the equipment as I am setting it up, seeing the anticipating look on a patient's face, as this could be one of the worst days of their life. The taste of uncertainty, even as I'm about to discover something about someone's life that I do not know yet. Without these scans, this patient might not get the proper treatment in order to receive quality health care. If you have ever had a broken bone, think what might have happened if this technology was not available. Or even in more threatening situations, you may have or have known someone in their life where a CT scan detected a mass. This mass could have not been cancerous, or it could have been. Without this technology, or people who work in this field, it could mean life or death. Thank you.